The month of September is Suicide Prevention Month. It's a time to stress the importance of having conversations with someone who may be in need of some help. Now on your sides, Caitlin Richards spoke with a behavioral health official here in our area. So Caitlin, how does this month help bring awareness to mental health?
Aaron, according to officials, every 11 minutes, someone in the U.S. takes their own life. That's why officials say now is the time to offer hope for those who don't see it.
Two groups of people. There's those of us that may be feeling down and kind of at that point of crisis, and whether suicidal or just depressed or anxious, whatever terms that you want to use. And then there's others that aren't in the same place and could be helpful.
Glenn Simpson is a behavioral health specialist for ECU Health. He says we all can play a role in suicide prevention.
Anybody can be a helper. We think of people who commit suicide as typically somebody who has been struggling with depression or some other mental illness for a long time. And that is often the case, but it's not always the case.
Simpson says many times people are afraid to talk openly about needing help, and now there's a new way to get that help. The suicide prevention hotline switched from a 10-digit number to 988 in July. Since then, officials say there's been an increase in calls.
So what we've seen in North Carolina so far is that we have seen compared to prior data, an increase of calls at about a little bit over 50%. So the initial data says we're now getting, actually, I think it's 53% more calls per day or per week than what we were prior to 988.
He says 1 in 5 Americans this year will suffer a diagnosable mental illness or substance use disorder. But there's hope. His advice to anyone who knows of people struggling, or even if you're struggling:
take the time to reach out, be nice, be kind, and if anybody's feeling a little bit depressed or down or in some sort of behavioral health crisis, call our friends at 988, 24 hours a day, 7 days a week.
He adds 70% of those who call in is their first time calling. He says that's a good thing since they're using the 3-digit number, whether in crisis mode or just needing to talk. In studio, Caitlin Richards, 9 on your side.